was a bit hectic today and we have to rush back. Thank you very much for being there. Today we're going to start important, interesting, and very good system, cardiovascular system. Cardiovascular system. Oh, that's yesterday's actually. Yes. Cardiovascular system. Can you all hear me? Yes. Cardio. Because of the heart disease. About 35% of all deaths that are happening in the world are due to cardiovascular disease. Hello? Nirmal, I just sent one ECG. Can you just see and please? Yeah, thank you. Sorry. So 35% of all deaths in the world are due to cardiovascular disease related deaths. So that is a big thing. In the US alone, there are about 1 million deaths per annum. Every year, 1 million. That is about 10 lakh people die of cardiovascular death, which means almost like. Hello. Yeah, mild interval changes that can be taken. Okay, thank you. Yeah, thank you very much. So 35% deaths, which means there are about 2,500 to 3,000 people die every single day in the US. And out of them, 25% are sudden cardiac death. What is sudden cardiac death? What is sudden cardiac death? SCD. Can anyone type, please? There is a definition of sudden cardiac death. It's not cardiac arrest. Cardiac arrest is different thing. No answer. Okay. Any death occurring within 1 hour after the onset of symptoms, chest pain, mainly, or breathlessness. Any death occurring after 1 hour of symptoms of chest pain in a patient who has pre-existing cardiac disease or no pre-existing cardiac disease. So anybody dying within 1 hour of development of chest pain is called sudden cardiac death. So 20%, 20 to 25% of the people we cannot reach the hospital. They die within first 1 hour, 30 to 60 minutes. So by the time they reach, they're already dead. So that is the statistics. So that's the importance of cardiovascular system. Of course, what are the causes of cardiovascular system? What are the causes? What are the types of cardiovascular system that you know? One is very important, is coronary artery disease, that is ischemic heart disease. And second is rheumatic heart disease. Second is rheumatic heart disease, but rheumatic heart disease is coming down now. 3 to 4 decades or 5 decades back, the rheumatic heart disease used to be a big number, especially in developing countries. But now, even in the developing countries, probably because of the improved sanitation conditions and hygiene conditions, the proper antibiotics, the rheumatic heart disease is an infection. So rheumatic heart disease are also coming down. So rheumatic heart disease related complications and deaths are also coming down, not only in the Western but also in the developing countries, including ours. So one is ischemic heart disease, second is rheumatic heart disease, third is arrhythmia. There is an electrical conduction system in the heart, which I am going to tell you. Electrical conduction system in the heart, which when gets disturbed for some reason, there's many reasons, patient can die suddenly. Patient can die because of this arrhythmias, bradyarrhythmias and tachyarrhythmias and complete heart blocks and things like that. Fourth is heart failure. The heart is a pump. Cardiovascular disease, when we mean cardio and vascular disease, heart and the peripheral blood vessels, be it arterial or venous. So heart is just a pump. It pumps the blood, but whereas the arteries, they take the blood to different, almost every part of the body, every organ, every single cell of the body. So most of the diseases, they are related to the homeostasis, the function of each organ in the body, including brain, liver, kidney, pancreas, everything, intestine, they depend on this vascular blood supply. So that is the importance of cardiovascular system. Heart is only pump, it will only pump. But whereas the vascular bed, vascular tree is the one responsible for supplying the required amount of blood, oxygen, sugar, nutrients, etc. So therefore, the heart and the vascular system together, we call it as, that's why cardiovascular system. Second is the pump failure. Pump, as I said, heart is a pump. Mainly the left ventricle. Left ventricle is a pump. When pump fails, either to failing to contract properly or failing to relax properly. Systolic dysfunction, diastolic dysfunction. Both ways, it can cause disease. Then cardiomyopathy. Cardiomyopathy is another set of diseases where your myocardium is a disease, myocardium. So there are different causes of cardiomyopathy: alcoholic cardiomyopathy, ischemic cardiomyopathy, diabetic cardiomyopathy, some inflammatory disease, some infections also can cause cardiomyopathy. Then infections, as I said, heart infections, though they are rare, TB can occur in the heart. So these are the various forms of cardiovascular disease related problems. One is ischemic heart disease, second rheumatic heart disease, third is rhythm disturbances, arrhythmia, fourth is failure, pump failure, fifth is cardiomyopathy, sixth is infection, and there are some many miscellaneous diseases also. So what are the causes of heart disease? Today we'll talk about general introduction so that the subsequent classes you will understand better. Causes of age, as you all know, aging which nobody can stop. Tomorrow I will become older than today. Day after tomorrow I will become older than tomorrow. So time is an irreversible thing. Everyone will become old. सास भी कभी बहू थी. So age is one very big irreversible risk factor for cardiovascular disease. The more your age, the elder you are, the more chances of one getting into cardiovascular diseases. Obesity, yes, obesity also is an independent risk factor.